Happy to be here. Thanks for Murli to organize all this and invite us. So what I was going to do was, maybe just for 1 second, I'll just add a little bit to what Sridevi had said. I was doing investment banking in US. So we invested, looked at things across different sectors, a little bit more biased towards technology. Then moved back, started this fund, PE fund with the TVS group called TVS Capital Funds. So I was a fund manager there. So as part of that, we invested in MedPlus here with Madhukar. We invested in Maxivision, the eye care chain. And then after that, I wanted to do something on my own, moved back to Hyderabad. And now I'm a little bit more into public sector listed companies. So we run a hedge fund. We're part of a hedge fund based in US. We have a 25-member team here. We also work with a lot of other hedge funds in terms of advisory services. So as part of that, we see a lot of different companies and different business models. So I thought I'll spend a little bit of time on that. So I'm not a healthcare expert, I'm not a doctor, but I've seen the ecosystem evolve. So I'll give you my perspective, but this is meant to be more of an interactive session. And as part of that, I also invested in one hospital here in Hyderabad along with a doctor partner. So I have some exposure to healthcare. I've seen this for the last 5-6 years in India. So I'll talk from that perspective. So to start with, I'll speak for about 10 minutes or so, and then we kind of open it up and use your companies as business model evaluation and see how we can be helpful. Yeah. So the first point I wanted to talk a little bit about is macro view, right? You should always understand where do I fit in what I'm trying to play in. If I'm a player in a game, what is the game I'm trying to play, right? India is a growth economy. 6%, 7% GDP growth. US, I'm just going to use India and US to just keep things simple, right? So US is a mature market, low GDP growth. So by definition, things that are growing would be what would be interesting here. By definition, US would be more interested in efficiency. How do I utilize my resources better? How do I engage with my customer better? So the word better becomes the key word there, where here you're talking to people, they'll say, how do I get customers? It's a very different thing, right? Both are very different. So when you think about your business plan, your business model, you have to understand which part of the equation I'm trying to solve. Both are very different. Yeah. So if you kind of go down that list, take a 6% GDP, how much do I spend on healthcare in India? How much does US spend on healthcare? India spends different sources, different numbers, 4.5%, 5% of GDP. US and developed markets spend 15, 18, 20% on healthcare. So obviously the market opportunity is large, very large. If spend goes up, but central government, state government wants to spend more on healthcare, that money will flow down in the system, right? So the opportunity is large. At the same time, we have to be conscious about how to tap that opportunity. Where is the opportunity, right? You have to dissect that. So please understand your core positioning relative to the market opportunity you're trying to solve, right? You can't just say healthcare is a big market, it's only 4%, 18%, billions of dollars, I'm in that, give me money. That usually doesn't work. Yeah. So you have to understand from the perspective of what I'm targeting, what is the specific market opportunity I'm going after. Things are very big, the macro is all very good in India, but the execution is where it really matters, right? Very diverse country, urban-rural split is pretty, stark. You have to be very careful what you're trying to do. A lot of companies have come up and said, we'll help you rural, semi-rural, Vatsalya Healthcare, big company in Bangalore, raised a lot of money over the years, trying to do these hospital chains across. Urban, a lot of different models, asset-light models, single specialty models, large hospitals expanding. So I think you need to understand where am I going, what is my real potential. You cannot just take billion people times this, times that, and say the macro is very good. So please understand your specific macro closely. Yeah? Micro view. I'll spend a little bit of time on this. I guess a bit more based on my experience. Healthcare, hospital, delivery aspect of the business model, if you think about that, right, is highly transaction driven in India. Very, very transaction driven. So what does that mean, right? The hospital or the doctor is only cares about that surgery, the average length of stay, my revenue per bed, those basic metrics. He doesn't care what happens afterwards. It's very transaction oriented. So if he or that particular institute, that hospital is your ecosystem in your business model or your customer, you have to be very careful. You have to understand his psychology. If you don't understand him, you're never going to penetrate. It's very, very transaction oriented, which has a lot of negative aspects to it that you will have to overcome. The value proposition that you have to propose has to be in line with his mindset of being transaction oriented, right? So if you can get him 3 customers, 3 patients on which he can do knee surgeries, then it's a different game, right? Are you playing on the margin there? So there are a lot of companies, I'm sure you know there are 25 companies here, 30 companies here. I hear Pune is the big hub for healthcare IT type of ecosystem now. A lot of people are going to Pune to set up companies. There are about 70, 80 companies, right? So you need to understand what everybody else is telling this transaction-oriented mindset and why are you different. Yeah. The next one is doctors are special. Some people say doctors feel like they're God, right? So you need to understand that and make sure that the business model sustains with and sometimes without the doctor. You don't want to be held hostage to the guy, right? So when you think about your business model, you cannot have 1 or 2 doctors dictate how you're going to do it. If he says, I'm not showing up today, and he says, do whatever you want, you have no business, right? So you have to be cautious about how you set up the arrangement with the doctor. I understand a lot of you here are not in the physical delivery of healthcare services. You're kind of enablers, technology enablers, platform enablers, productivity enablers, but still the doctor is at the center of the ecosystem. If the doctor says no, the hospital will take out your software. If the doctor tells the nurse, I don't want to see this anymore, you're done, right? So he's still at the center of that. So the incentive system is what they have been totally used to. Whether you want to call it referral fee, whether you want to call it different names, right? The doctors have been fed for the last 20 years. That's how the Indian culture is. So you need to just studying for 5-6 years, getting into medicine, that's all he has done, MD seat, if not he has paid a lot of money for that MD seat, etc., right? By the time he's really there to earn money, you cannot be there to cut his money. You have to enable his money, right? So that's very clear that you need to understand the model that you propose has to be a win-win. Yeah? And I've also seen many hospitals are highly entrepreneurially driven by the doctor, with in many cases with his wife's name, his daughter's name, son's name. So it becomes very close to heart, right? They will do everything to protect that business. That becomes their identity in the society. So you need to understand whom you're dealing with, right? If you can get Apollo, if you can get Fortis, yes, you'll have a customer base. Again, the negotiation is different, right? That's a certain type of business model. If you're actually going to say, I'm going to get 100 hospitals distributed all over, you're going to most likely deal with these folks, right? Below the top 5 chains, everybody else is completely fragmented, mom and pop shops, right? So how do you deal with them? It becomes very critical, right? The last one, which is a bit of my experience as well, they are very cautious. They don't like to let anybody in. They're also, I guess, anti-consolidation, right? So what that means is, if they feel that somebody is going to become powerful and he is going to dictate to me, he will then give that business to 2-3 more people. He doesn't want to completely rely on you. He's always thinking, what is my bargaining power relative to him, relative to the supplier, relative to the nurses. If you say I have a nursing company, I can supply all the nurses, he will try 3-4 from you. When he thinks it's becoming too much, he'll want to call somebody else. So they are extremely smart, right? So I would like to say the highly entrepreneurial doctor is not a cab driver who is just jumping on Ola or Uber and says, I'll take whatever aggregation model you have. He's anti-consolidation. He's going to split up your model and say, I'm going to try different things. So I'm telling you all this based on experience so you are aware of whom you're dealing with. Right? He doesn't like consolidation. If it's consolidated, his name will be gone in the society. Hey, he sold out the hospital because he couldn't run it. Nobody will say that he cashed out. The usual assumption in the society is that it's been sold out at a discount. Right? And many of them are struggling. So they're very, very conscious about costs. Right? So the micro aspect of it, the macro is great. The number of beds, this, that, all that is great. But when the reality hits the ground, I have seen many, many companies. There are a lot of people that I talk to in the healthcare space and they say, hey, I'm doing this, I'm doing that. After 4 years, 5 years, I find many of those businesses still at the same point. Yeah. So it's not because of lack of entrepreneurial energy. It's not because of lack of passion. It's a tough market. Number one. Number two, highly competitive. Yeah. Number three, there is a social aspect to this that you have to balance in your business model. You'll run into this all the time. School system, suddenly you feel more passionate and say, hey, I'm helping all these kids with school healthcare. Somebody is doing the pediatrics, newborn stuff. So they'll feel very passionate. So you have to figure out where is it that you want to spend time on. This is a multi-year process. This is not a quick flip. Healthcare is not a quick flip. Yeah, it takes time. So I just want you to think about the micro picture carefully, evaluate your business model and say, hey, this is what I'm trying to do, this is the environment I'm in, how am I going to do better than others? The reason I'm saying all this is, see, your capital and your time is precious, right? You have to figure out how to optimize that. So I would do the same for my part, right? That's why I'm telling you this. Optimize your resources, the limited capital, highly distributed, as I said, diverse, urban, rural, it's a very complex system. So you please focus, create a niche. In 4 years, you have to be the number one, number two, number three player in your niche, in your area, in your domain, in your region, however you want to define that. Otherwise, I think it's going to be a very, very uphill task. Yeah. So if you say, I'm going to be the number one school education, school healthcare business in Andhra Pradesh, you have to clearly define in Andhra Pradesh or in Telangana, whatever, right? And then say, hey, I'm going to do this. So that is how you have to approach this. You have to be very, very specific in what you're trying to achieve. Yeah. So in terms of business models, so you understood the macro, looks great. Micro is a little bit more tougher, right, as usual in most cases. I'll just hit on these and then I'll kind of use your own companies to kind of analyze a few, right? Hopefully that will be helpful. So here I'm just going to talk about few things that I see when I look at the business models, right? So if you want to raise money, think what the investor wants. If you're going to be self-funded through accruals, through your own money, through your own capital, then you have a slightly different approach. So you have to figure that out as well. In my view, given that India is a growth economy, and if you go to anybody whom your customer who is going to pay you, if it has anything to do with the delivery service business, they are looking for new revenue. As I said, they're already highly entrepreneurial folks. They know how to do the basics. You have to help them get new revenue. It's not an efficiency game. If you want to do an efficiency game, you have to be there for the next 10, 12 years. It will take a very long time. Because the Indian system is not still at the efficiency level, in my view, right? So if you're looking for helping somebody with your business model, solving your business problem, solving a pain point, you have to think about how will this help my revenue for the customer? How will it help him? How will it enhance his business? If you're saying I'll help the doctor connect better with the patients, eventually him going to the cloud and clicking all that, okay, it's helpful, but is it really required? Right? So he is going to say, can you get me 4 more patients? If you can add the 4 more patients, you will break even faster, you will grow your business faster. If you're going to tell him, I'm making you more productive, that I can help you see more patients, I can't help you get patients, but I can help you be organized, it's less of a pain point Maybe the doctor doesn't need to be organized. Why do you want to impose that on him? Right? It's not a real pain point. I'm just trying to use some examples to contrast the situation, right? So focus on new revenue to the ecosystem, to the hospital, to the doctors, to your customer, etc. Right? Efficiency can be very useful if there is a real pain point. If there is a supply chain issue, you have a medical device portal. I saw somebody has a medical device portal to get things, and you can get that at a better price, better quality, at a better time frame, etc., without a lot of working capital. Then you're really solving a problem, right? The stents are 50,000, 60,000 rupees. If you can take out 10, 15, it's a big deal. Especially if you can get a good branded one, you have a different sourcing agency, etc., right? So things like that will be helpful, but try to focus more on the revenue side of the equation. Asset light, I'm sure everybody heard this, is like a very easy term to use across the system. All it means is I can use my money in a better manner than anybody else. To me, that's the bottom line, right? It doesn't mean that I have to open. Well, to me, is the secondary point. The main point when somebody says asset light is, how can I use my money more efficiently? I don't want to buy the land, I don't want to buy the building. I'll just pay the rent. Keep it, think simple. I don't want to buy the equipment. I will lease it, right? I'm not going to have all these payments to different people if I don't have to, right? So I don't want to put 40 crores into one building and, I want to do it in 2 crores, 3 crores, 4 crores, see if it works, doesn't work. In my experience, having a hypothesis of what pain you're trying to solve and see if that can be solved or not solved, or if you have to pivot to something else, to a different hypothesis, that nimbleness is the most important thing. If you want that to happen, then you don't want to put all your money in one place, right? You need to keep some of it to try different things. The first 2-3 years of being an entrepreneur, trying to do different things, to see where the model actually works, is an iterative process. You'll never hit it first time, right? Since you're not going to hit it first time, how do I keep my capital efficiently utilized for the next thing to come, right? To me, that is more asset light. If you walk in and say, I need 100 crores, say, why can't you do it with 2 crores? Figure it out, see if the hypothesis works, see if somebody wants to come to you, see if your service is really valuable, then it automatically grows, right? Distributed versus centralized. Different people have different views. Some people think 150 hospital beds is the way to go. There are a lot of synergies from human resource management to equipment purchasing, etc., etc. Some people will say distributed is better, my risk is spread, I don't need this. It depends on the specialty. It really depends on the specialty. You've heard of Nova Medical, scaled up very, very fast and got into a lot of trouble. Investors lost a lot of money, right? So big Apple Cradle has taken that facility, right? So it depends really on what you're trying to do, right? I don't think there is a clear answer saying for this only centralized works or only distributed works. It depends on your specialty. Dentist is a great story. NephroPlus is a great story. All these have distributed centers. If I can only have 15-20 beds of efficiency for providing my NephroPlus service, then I don't need to be in one place where I have 250 beds, right? So it's a very easy solution. It really depends on what you're trying to service. To me, it looks like if you're trying to, I guess, disturb the existing market to create a place for yourself, for your company, some of the consumer-facing stuff seemingly has a little bit more traction. NephroPlus goes direct to the customer, right? Portier goes direct to the customer, right? MedPlus, big success story of Hyderabad, goes direct to the customer. Right? It doesn't depend as much on the hospital as much on the doctor. So you have to think about which business model do I have where I'm a little bit going towards the consumer-facing stuff for me to scale up. There is a tremendous opportunity there, but that business model has its own pain points, right? How do I get customers? You have to scale really fast. Can I raise money? For raising money, do I have the right team, the right process, the right system? All of those things come into play. But consumer-facing is definitely something that's kind of been hot for the last year and a half, and still seems like a lot of business models are coming in that space, right? Because the big ones have already taken the established pieces. Margins versus volume. You have to be clear. Am I going for margins or am I going for volume? Usually it's very difficult in the early days to go for both. You either figure out I want to go for margins, then you'll have a certain type of business, you do that well and then you replicate. Or you say, hey, this basically works on volume. Practo example is volume, right? They're only going for volume. So idea, product versus getting customers. Somebody called me 2 days ago from Vizag. He was describing how he has done this pediatric software system and so on. He said, what next, etc., etc. So again, I'm going to be a little bit blunt here, right? Developing an idea, building a product has become very easy these days. I'll host it on the cloud. I use all these tools that have already been built halfway through. I just have to put the interface layer. I'm not building a database. Database is already there. I know how to manage this, right? So you need to figure out what is it that I'm going to do with this. He talked for like 35 minutes. I just listened to him for the first 35 minutes. He just kept on telling me 40 people invested, 1 crore per year invested, done it for 6-7 years. I've built this fantastic product. So can somebody else build it for less? Highly possible, right? So to me, that's what I told him. You have spent your quality time of your life, your money, and you're feeding 40 people. At the end of the day, what you have is product. You never told me even once that you have customers. So he said, I'm going to customers now, that's why I called you. I said, you're wasting time. The pendulum has to be swung more towards customers. You have a working product, you take it to the market, see what happens. You don't know what he wants. Knowing what the customer wants is the greatest puzzle, right? So that's why you have different hypotheses, different things to test and try, and then see what you can do with it. With the current system of technologies, you can build something in 2 weeks, 2 months, depends on how good you are. Do I need 1 person or 5 people in computer science? That's becoming like an irrelevant question. Do I have customers or not is what matters, right? Nothing else matters. Even if you go for some amount of angel round, people are asking, so who are the customers? Who are paying? How long have they paid? Did they renew it yet? So the renewal of the customers really shows whether you can actually retain the customers that Murli was talking about. Yeah. So please focus more on customers. If you keep building and putting all your resources, capital, your time on fine-tuning this great product you're building, it'll be like a wonderful painting. You can sit and enjoy it at night. Right? You have to figure out if anybody has value for it. Yeah? So I'll stop here. So that's all I have to say. So think about the macro. How do you fit into the bigger macro? What is driving public-private partnerships, central government spends, etc., state government spends, so on, right? Where do you fit into that? The micro is very tough. Who am I dealing with? Do they really need this? Does the doctor really need it, or am I shoving it down his throat, right? So you have to figure that out. Digital records, etc., etc. It's a big thing in US, a lot of stuff going on, but does it really need to be in India? And who are my customers? How much are they going to pay? Digital records, I think there are like 100 companies in India. So how many hospitals are using it? Yeah. So it's a constant struggle. Yeah. The hospital management systems, ERP systems, I think CARE changed it 3 times in 4 years. We used to use one vendor, same CARE was using it. Then I find out next year that CARE has switched over. So I don't know why they're switching over, but all I'm telling you is it's a tough market. You have to find your differentiation. What is the differentiation that you want to do is very important to identify at the beginning. Don't spend 4 years building something if you don't know the business model. The business model to me is far more important than the product. If the product looks in a certain way, but you have an idea of how to take this to market and what the business model is, that is more valuable. I can hire a computer science guy and go fix it tomorrow. Before you spend your resources, your money, your time, effort, etc., passion, emotional amount of energy that you spend, figure out your business model. The most critical thing for an entrepreneur to know is the business model that he's going to use. That business model is what is going to get you the money from the investors. He is willing to overlook deficiency in the team, what you need to hire, the product can be modified, etc., etc. But if you have a clear vision of what you want to do and how you want to do it, and it will actually work with some hypothesis that I've tested this really works, that matters much more. Yeah, at least to me. Okay? So I'll stop here. I see that there are a lot of you are already started the businesses. So I'm sorry if I meant something where it's not, you guys are doing all these things. So it's not meant that way. It's meant to kind of provoke you a little bit. I'm sure a lot of people will come and tell you, healthcare is great, this is great, to spend 5 crores, 10 crores of your money, but be very careful, right, where it's going. Yeah, I'll go table-wise. I just wanted to maybe use a couple of tables. I don't know if we'll get to everyone. Talk about your business. Literally 1.5 minutes. 25 companies, 1.5 minutes itself will take away 40 minutes, yeah? So, what is the business model that you have, right? And what is the pain point you're trying to solve?
I will start with the pain points,
yeah.
And the gap also.
Please, your company and your name.
Right. My company is RO's Healthcare Services. It's not a product, it's a service company. What I have seen in an area like diabetology, not lot of patients are not
turning back. Can you please
back.
stand so that everybody can see you?
Not lot of patients are turning back to the hospitals or clinics, which is almost 70% of patients not coming on time, and 50% of patients not taking medication on time. What I want to do is I want to be help doctors, or I want to offer a service to the doctors to bring back those patients on time, and also help them to refill their medications, patients' medications, and send home sample to the patient on behalf of hospitals or clinics. The business plan is in the value chain. Even though the patient is getting better health, but doctors, diagnostics tests, and pharmacies, the people are getting more revenue. So I'm still figuring out, who is the better person to, pay in this value chain based on the percentage or whatever. And I have a couple customers, but I built a minimum viable service model and started testing on that one. So honestly, I don't know whether.
When did you start?
I started March 11th.
This year. Anybody from this table with any comments on his business model, questions, ideas, suggestions? Mike,
So what you're trying to do is build efficiency into the system, right? Or retain the customer. Hospitals. I work at a hospital, and doctors, unfortunately, they don't yet see the value in terms of once it's like Suresh has eloquently pointed out, it's a transaction-based model, and when a patient shows up, a doctor sees them, and they go away, and that's it. They're gone unless they're a VIP or they've spent X amount, right? So, in terms of educating the doctor, getting their time, and making sure that they understand this is what they're missing out. Again, unless you show that they're making more or getting more benefit out of it, it's going to be a tough proposition in terms of you have to show the value.
Right. What I've done is I've done like a 3-month study for that total clinic, and I showed the doctor by calling them, I'm getting more patients on time, and he's got more revenue, as well as this clinic has both a diagnosis center and a pharmaceutical drug store, and it has seen improving revenue in both areas.
Okay. Try it in 10 different clinics. Sign up few hospitals, see if it works across doctors, right? I think you need to take step by step and see how you're going to proceed.
Right. The challenge right now is having is, even though I got one clinic and one hospital, the hospital is doing like a post-surgery follow-ups. I see attraction there, but clinic-wise, I'm spending, acquiring new customers and spending more time and going back and again and again and again. So I think what you mentioned,
it's a great area to be, who not like more customers. And more
repeat customers.
Yeah,
especially customers coming back.
It's a great area to be, but it will take some time to convince you.
Correct.
It's working, and if you can quantify it, nothing like that.
So I concur with him. This is a longer term business model it looks like. So you need to have the patience, energy, effort, capital, all that. If you're planning to do this, you know. I just want to, as he was talking, I was just thinking of one more thing, right? If you think about the healthcare ecosystem, insurance is growing. Are the insurance companies making money?
Not yet.
Not much, right? They're discounting. I have a general insurance program. I'm giving also health insurance to you. General insurance is discounting the health insurance, right, to a certain extent. Who has the most data in the country? Insurance companies? Yeah. So why are we not thinking about insurance companies in some way or manner be your part of your ecosystem to scale up faster? Just a thought, right? You need to think where people is, where data is, etc., and use them more effectively in your business model. Can we have somebody from that table?
I'm Dr. Mohan Rao, medical doctor, good in computers also. I developed an artificial intelligence system to prevent doctors from making a misdiagnosis. So the major problem in the hospitals is 1 in 20 admitted case is either made a misdiagnosis or a diagnosis is missed, resulting in loss of life and a lot of problems to the hospital.
But the hospital wants to, does the hospital want to disclose all that?
Yeah, the patient comes to know about it. So we developed a system wherein that computer suggests the diagnosis. We use the algorithms developed and published in the journals, artificial intelligence journals. Spent 20 years developing the product. Last year, now the product is ready using the latest technologies. We are ready to get into the market. One of our ideas is to serve the end-to-end to the hospital services, wherein we extract the digital data, divide into the features, like the patient data, symptoms, signs, tests, drugs, diseases, diagnosis, and use it as a possible diagnosis and give a test.
Yeah, I think I understood the case.
Yeah, it's the, like, for example, the insurance product, insurance agencies you suggested, they can have a graph for each of the chronic diseases.
Correct.
And say who are likely to go away from these graphs, identify them, target treatment for them, so that the complications will be reduced.
No, I think it's a great one. There was some discussion about this somewhere else I was, and the point was, will the hospitals in India today agree to a third person coming and putting all this data in place, which can actually be of huge help both to the insurance and the patient. But the hospitals are not incentivized today. They don't want anybody to know that I have done 25 admits to the ICU and 2 of them had infection and died in my hospital. They will just say that you're sick, right? This happened, and I know of a couple of cases in Hyderabad itself where patient was reasonably okay, but for some reason he was in ICU, he gets an infection, they just, they never want you to get there. The whole aspect of patient care metrics and data is again a huge space. It's a huge market in US, a lot of companies who do this very well, third-party outsourced companies. But the problem there is the insurance companies and the HMOs in US kind of enforce that, but we haven't reached that stage of maturity. Again, this is a business model question, right? Have I reached the stage of maturity to implement that in my market? Timing is everything, right? So I think this is a great opportunity, but feels like a bit early. So the way for you to kind of take this to the next step is convince 1 or 2 large hospitals to do this, and then go to the insurance guy and say, look, I've done this, it is very helpful. You enforce it through your system. Otherwise, tell them that I won't clear your bills from your hospital, and slowly get it enforced. It's a big challenge. This is like a mindset change, cultural change, everything you want to call it, very difficult. but you have to get 1 or 2 large hospitals to buy into this. This has to start from the top, right? The business owner, the doctor has to feel it and then enforce it. The mid-level and the lower levels don't like to implement this. Yeah, thank you. Yeah, anybody from that table, please.
Buys into your whole product. Now, who decides that your algorithm or your product actually gives out the right results? It is giving the right results, no question about that. But who is backing it? Is the health regulatory backing it? Is the government of India backing it? Is the FDA backing it? Because without that kind of regulatory, it cannot be accepted as that will be a big challenge for you guys.
Right. I think that's the way it is done. Because you're talking about the hospital, and the hospital has to keep the records with the compliance for at least 10 years, 7 years is the minimum, need to keep it. So whatever the intelligence which he's talking about will be useful for the physician.
Sure.
But the challenge over there is not regulatory stuff, is the doctor himself to understand, okay, how I can optimize, where is that, I'm losing out, is the drug efficacy or is the, actual treatment, which is much more precision treatment, so all those things are internal for it, which is no patient centered.
That's fine. That's
There's no
sales
issue
and
of
adoption.
compliance issues.
That's a sales and adoption perspective. That's an adoption by the hospital. That's fine. That probably you can convince the doctor to understand.
Yeah.
But who is saying that the algorithm that they have written is correct?
Certification, right?
What's the certification? If he says that 7%.
That I think can be established with experts in the
That's-
market.
yeah, so
I
that has
think
to be done.
his point I think is well taken, right?
Well taken, yeah.
The doctor doesn't want to be told that he has made a mistake.
Exactly.
Right? He's
Yeah.
looking for 25 different reasons to say it's not me, right? So in that ecosystem, how do you implement this?
Yeah, so
That's
that
the
point
biggest
is
challenge.
noted. It's
So it has to be a cultural transition that has
Correct.
to go through.
One
Is
point-
India right for it? Is the question.
Yeah, that is the big question actually.
Yeah, please.
India is way behind in the adoption of electronic health record. Even in US, I've been working with US Healthcare for the last 12 years. Their beautiful clinical decision support systems have been built, but doctors refuse to adopt. And India, I think, is a little way far off.
Yeah.
The hospital, first of all, has to have digital data available for you to run your beautiful software. So, and second, getting in and trying to prove it, and that is the second
So
challenge.
it falls into the last bucket there. Great idea, great product, right? How do we get customers?
The
Right?
best
That's-
thing for them would be not to get into the retrospective analysis, go for a randomized control trial, prospective one, choose 4 patients in one category not using your product, 4 types of similar patients in case where your product is valid, do a RCT in couple of institutes, just show a significant
Yeah.
p-value, will
Correct.
be validated, all the bodies will sign.
Yeah.
So-
But a prospective RCT is the one which will not contradict any doctor's this thing. There could be something, today MRSA will kill 8 out of 10 patients in any IC,
Yeah.
be it Apollo, Vedanta, anybody. But the thing is, no doctor wants to take that. There's no
Correct.
antibody for that. Cholesterol is the last one done. We don't
So,
have
is-
antibody
should
for the
he
bugs.
go to,
So don't try to show doctor's mistakes, period.
Yeah.
Don't try to. Show that it is your friend. Just try using this, it is your friend, it will, on the contrary, it will help you reduce your mortality and morbidity rates. Done.
somebody reputed, Jip or AIM, somebody like that has to take the initiative and kind of say, hey, let me try this.
So one
Yeah, this will
RCT
follow.
from a bigger institute, your validators. I'm sure you know that, but just reinforcing it.
Anybody from that table? Yeah, please.
I'm Dr. Rajshekhar. We are a platform connecting the road accident victims to the network hospitals through our ambulance aggregator. So my business model is, so we are getting new revenue to the rural hospitals which are on the highways, which are not doing very well. So we are getting them patients then and then through our ambulance aggregator. Yeah, of course it is asset light, we are a platform, and we are distributed all over India, pan-India. We will become, and we are facing consumers. We did a lot of pilot studies. I being an orthopedic surgeon running 3 hospitals across this highway on Hyderabad-Mumbai highway. So we pivoted from actual hospitals to platform. So all the 10-15 years experience we are putting into this platform to get new patients to the rural area, rural hospitals, which are not doing that great.
That sounds very interesting. Anybody from this table with comments? Yeah.
Can I talk about my...
Why don't we comment on his? We'll come to your table next.
I think that the rural model is very interesting and beneficial. The only challenge I see is that the connectivity and availability of software with the rural hospitals and
we are connecting to the apps. We are connecting to our website. We are subscribing people on apps. And we are there will be one button, emergency button. When they press, it will go to our call center. That is how the value chain works. Okay. So they are connected through an app.
I think what he was asking was, your app does all its work. The patient comes to the rural hospital, the highway-based hospital. Is there enough service quality that you can manage sure there? If something happens there, they'll blame your company and your app.
We are training them and we are getting them a few products which they are not there. So we are getting CT scanners, for example. These accidents, most of the accidents occur in rural areas on the highways because most of the highways go through rural areas where there are no equipment.
My challenge is actually infrastructure, okay, not just apps.
We have developed a model which is very cost effective.
I understand, I agree. I'm just saying that what could be the challenges for you is the infrastructure, whether it is telecom infrastructure, whether it is electricity infrastructure, whether it is road infrastructure. For the people to be transported if needed to be a different place, okay, even if you press that emergency button, for this person to be connected to the next hospital and the hospital has to send the ambulance or something.
We are aggregating the existing ambulances. I have a data of having 1.25 ambulances all over India. So across these highways only we are working, not in rural areas. We are working on the highways so that...
But you already have 108, so are you competing with 108?
108, they are not standardized, their protocols are not standardized. We are not sure about their arrival, on-time arrival, we are not sure. And they are just picking the patients and dumping it to the government hospital where there is nothing. Again, from there you need to go to a private hospital where there are facilities available. Again, once you go to that private hospital also, you don't know whether it is equipped to treat a road accident.
Do you have a comment on this? Yes. Please, go ahead.
It's like a very saturated market. I give you two examples which I have experienced. I serve more than 200 hospitals. So one of the hospital, one reference, like it's all works with reference. Accident happened at Gulbarga highway. The patient comes to Hyderabad. So in Gulbarga, like the hospital, main hospital doesn't have the entire neuro specialty. So that's what they have to bring it to hospital. The Hyderabad hospital guy is connected to the ambulance guy in Gulbarga. See the network. It is amazing network. I was shocked because I was connected through the patient and I was connected to the hospital as well. And I was amazed at the network at which it is. It is a big nexus, like one. Yep. And 108 like is already at a threshold, but this is a private ambulance which has come all the way to Hyderabad, carrying almost like 5-6 hours, like the patient and all, and there's no support system for it. So I think the my like quick thought on that is like the connect is the like wrong word over there, but basically you're trying to aggregate, like that's something which is required. You're saying even 108 is not aggregated, so that is somewhere like so. But the network and the nexus is like really connected very, very well. Like,
I agree. All the hospitals in Hyderabad are very tightly with the ambulance driver. They know exactly which hospital to go, and the driver knows how much to get. It's all very highly connected. So I guess anybody has a thought to help him on what he could do before he invests more money, and say, hey, test this, otherwise don't invest more money.
The air ambulance would be the best thing to try, and then the platform should be like
That is an illegal nexus between these hospitals and 108. That can be easily broken once there is an awareness in the patient that this is happening. So whenever there are facilities available in rural areas, why do they come to Hyderabad?
As difficult as it may seem to build a network, it is as difficult to break a network.
Yeah, true.
Many cases, unless there is a really compelling reason, something is going to completely disrupt, breaking an existing network is very tough.
No,
So that is something that you have to
doesn't
figure out.
carry a patient from Gulbarga to Bidar. They have a restriction of carrying it to only 20-30 kilometers. Yes. The private ambulance, they will go to anywhere. See,
That's what he is saying.
Yes.
Yeah.
Give them bread and butter, they will come to you all. In rural areas also they will come. You get them some patients.
So you have to figure out.
Revenue model is will get some commissions from the hospitals and the ambulances, and it will be free for the patients. Yeah. We will have some subscription fee for. Yeah.
The other disruptive solution would be provide a glass on the highway.
Yeah.
Like like a button, you're saying in the app. Instead of that, like how the calling book is there.
Yeah.
Calling book. You provide a coax there at all the highways. People know that if I press this button, I will get connected to the network. I think that would be.
Yeah, that we are working on.
So you have to do some basic modeling, understanding, go to one network, see if you can break it before you scale up, before you put a lot of money into this. What is the milestone you want to achieve before the next phase of investment of time, resources all goes in, right?
Can I just suggest something?
Yeah.
Because your focus is on the app, but I think because the ambulance is the basic delivery vehicle here, if you could even think of one critical care ambulance, now you have sufficient data on accidents. You know which are those highways where maximum number of accidents are taking place. Get some investment, put an ambulance of your own, which can do critical care, and then tie up with hospitals within 25 kilometers. I think that would be a far better way to break this nexus and then establish your foothold. You'll have to get into ambulances as a part of your business model.
So you started with the idea in the product. Yeah. Now if you have to go to getting customers, maybe that's what you need to do.
Sure.
Yeah, I think that's the transition you have to make. Yeah. Making an app has become easy.
No,
Right, that's the point he's saying. Don't put all your energy, effort only thinking about the app. Yeah? You wanted to say something.
Yeah, hi, my name is Rajendra. I represent a company called Sinistra Software Solutions, which is a startup, which is likely only yesterday started working. Okay.
Yep.
So obviously I'm still in the ideation phase, and one of the ideas that I'm working on is creating an aggregation of all the medical services, specifically focusing retired people who are away from their children, probably MRIs parents, etc. So who need their healthcare services. This is an aggregation where we will be connecting all the hospitals, pharmacies, diagnostic centers, home nurses, and everything, where with a single button they can get all these services. This is what is the idea that I am brainstorming.
My first reaction, pick a smaller niche. Don't try to solve the entire world's problem in one shot.
Okay.
Make it very complex. You're already talking about hospitals, diagnostic chains, etc., etc. Everybody getting into the Call Health has put in 250 crores is what I
absolutely, guess. I know. Call Health has come from my own earlier organization, that's Tech Mahindra, Satyam. Yeah. Okay, so my
as an entrepreneur, when you're trying to start something at this stage, when you start thinking from yesterday,
right,
pick a smaller niche that you can achieve,
right,
hit the milestone, then broaden it.
Okay.
If you're saying I'll do all healthcare services for elderly people,
no, but I will only create a platform. I'm not going to do the actual service. I'm going to create the software program because I come from the software background, and let the people work on that. So create an app and a platform and a portal. Yeah, this is.
So why should the hospital use you? Why should Vijaya Diagnostics use you? They already have tie-ups, central government health insurance programs. There are a lot of different aspects that you have to see why they would come to you.
Yeah, basically I am looking at more like a red bus kind of an aggregation, right? So all the bus companies have their own apps or their own app portals, but still they use red bus as an aggregator.
I don't know everything. Sachin may know. There I think at least 50 companies doing aggregation of healthcare services in India. Okay. Pune mein there are like 30, 40. So aapki marzi how you want to differentiate. But all I'm saying is think carefully of why somebody would come to you. Just because there are 4 computer science guys who can do an app doesn't mean there is a business.
Right.
I just want you to be cautious before you spend a lot of money. More than anybody else. Right. Okay. The only way you will know more than anybody else is by you digging deep into the whole ecosystem and saying Vijaya Diagnostics has whatever 100,000 customers per month, of which 15% are elderly who can't come to Vijaya Diagnostics. I'm trying to solve a pain there. X number of people have cardiac surgeries at these hospitals. They're already paying 2 lakhs for the cardiac surgery. Who is paying for that? Why will they come to an aggregator site to go to Apollo's cardiac surgery place? You should have a lot of research, lot of data points, lot of understanding yourself before you put your time. I think that's the point, right?
Absolutely. I mean, like if he started yesterday, he's not losing anything.
Correct.
He's not in a position.
He's not invested yet. He's not invested yet.
He can get started anywhere.
So you spend the next 2-3 months doing detailed research, not on the software, not on the app or anything. Think about the domain you're trying to solve the problem for. Only the domain and the business model will help get solved by an application. The application doesn't solve the domain.
Absolutely.
Yeah?
I agree. No, I looked at the pain point because I find many of my friends' parents living in India not having proper access to many of these, whatever we are talking about, the aggregation. So that's where I started. I agree with you. I need to do a lot more research on that, because why these people are not able to service the end customers who are still in need. I think that's the thing that I need to work on.
Maybe I'm biased. I feel that there are enough hospitals, enough good service available in urban areas at least. Too many of them, they're competing, they're all in losses. 70 to 80% of the hospitals in the city are in losses. They're not making money. The stage for everything.
My name is Raj, and like the same gentleman said, I am already into aggregation of diagnostic labs, and we started our company in the month of March, and we have aggregated all the top diagnostic centers in Hyderabad, where a patient can choose any diagnostic center as per their price requirement. And here what I have observed when we have started the company 3 months back to till now is this service, what exactly the customer is looking at is the service side. Now, even as you said that, yeah, major diagnostics like Vijay and all are actually doing good business, but at the end of the day, a patient is not having much time to go to directly a diagnostic center and getting the test done, and again going back to diagnostic center for collecting the reports. So in that particular area, we have worked out in such a way that something like what do you call it? Preventive medical packages. That is what we have designed, and they can simply go down to our website or mobile application. They can choose whatever test they want. And
can I interrupt you?
Yeah, please.
I want to make a point there.
Yeah.
If it takes this many minutes to explain your business, you are not sure what the core is.
Okay.
I'll give you an example. When MedPlus was trying to raise money, Madhukar said, pharmacies make 22% gross margin. I want to give away 10% of that to the customer and acquire them. MedPlus is a discount pharmacy national chain. That's it. You need to be clear. He said pharmacies in India, mom and pop, everywhere, 10 years ago, 15 years ago, even today, they're all everywhere. They're all making a lot of money. There's a lot of money in that pharmacy, 22% gross margin. Comes, he also doesn't take the inventory risk. Whatever tablets expire, you can give it back. Right? So he said, I am only saying 10% less. If you want the same medicine, you come. There's nothing else. The whole pharmacy association revolted. There were a lot of lawsuits, just fight, that fight. He went through that battle. Never deviated from being a discounted pharmacy retail chain. So you have to tell me something to the customer of why he would come. You're telling me efficiency of clicking, etc. Paise batao yaar. Can you get me into Vijaya Diagnostics cheaper than if I go directly?
Yeah, I mean, yes.
That's exactly what you need to focus on. What is the return on my money? Why are you wasting my time? If I'm a customer and you're telling me, if I get to your site, I'll be cheaper than going anywhere else, 20% below price at Vijaya. Because of you, I'll come to you. Otherwise, I won't come.
Like on an individual
So,
basis.
my only point, given the interest of time, you need to be very clear on what the bottom line economics are. That is business model. If you don't know the bottom line economics, you don't understand your business model. You're still debating, researching. Very clear? That is what he said, 22% gross margin, 10% देना है, 12 टिका में मैं कर लूँगा, धंधा चलेगा 12% पे, done. He raised enormous amount of money, it's 1800 crores or something in revenues today. Right? That's the only model, nobody else did it. Now everybody else is offering discounts. Right? That's how you break the market. Anybody from this table, you like to go? Last one.
Hi, I just go here so that I
Yeah.
log these guys. I'm Pranay, and my company's name is Pratibha HealthCon. We are in the traditional complementary and alternative medicine segment. And we bring patients and practitioners together where value is delivered through a video consultation. So there are two sides of the story here. The value proposition for the practitioners is to be able to get their practice online so that they can enhance their area of influence beyond the local geography. That's part of the new revenue top line, where they look beyond their local geography to acquire more patients during their, keep it flexible and monetize their idle time. From a patient perspective, it is demand driven, particularly all the problems that they've been talking about, where healthcare is delivered at home. They schedule appointments. It has statistics have shown that about 60% of the visits to the face-to-face visits are not required. So there is a process by which the case sheets and all can be submitted to the practitioner, and when they get into a video consultation, they get a dedicated 15 minutes as an additional or value addition. They can also opt for medicine to be delivered at home. So that is what we do in terms of...
Any comments?
Most of the other home healthcare companies are also doing this.
Segment is not conventional medicine. This is the segment where we position ourselves as a traditional complementary and alternative medicine segment, or what otherwise you would know as Ayush. It is not the conventional medicine. And we focus, just to add to that, we focus on non-communicable diseases, because India has the highest incidence of non-communicable diseases in India. Just for the healthcare professionals who don't know what non-communicable diseases are, the top four being cancer, diabetes, cardiovascular and respiratory ailments. So our focus areas are wellness, disease management and rehabilitation. So the entire offering is built around these specific areas where we will build trust, hold hands because there is a constant need for the patients suffering from these to be heard and for them to be able to talk and then improve their quality of life beyond just the medication that they have. So right now these people have medication. We are saying it's a pluralistic approach. We are not challenging that this is better than the other. No, it's not. What we're just saying is continue to have your medicines, but there is a quality of life that you need to have. That could be from mental to physical. So that is what we are trying to address.
My question is like, and then now everything Ayurveda, homeopathy is there. My question is like, what is the revenue model? Because it's already affordable. It's almost homeopathy is free, I consider. 10 rupees, 20 rupees medicine and like consultation, they do it free. So many homeopaths, so many Ayurveda. Patanjali itself, like, big Ayurveda. You go to the neighborhood, this thing and you'll get that. So in that way, like, where do you see your revenue, like, model coming in?
So the revenue model is transactional. Basically, we do not, the practitioners who are on board do not pay for any subscription like any other offering. The patients just pay their consultation fees to the practitioner. We charge an internet handling and a convenience fee in between. That's about all. And completely agree with the institutions which are giving free homeopathic stuff. But when I'm talking specifically of disease management, then you would like to go to a homeopath and pay for it.
I'll put his question in a different manner. to get to 1 crore revenue, how many transactions do you need? So he's trying to make a point, you don't have to answer it. He's just making the point that if I need at least 1 crore to at least fund my basic costs, how many transactions do I need? Can I get those? Is that reasonable? So how do I get that scalable? I think that's his key point, right?
Yeah.
Anybody else? Question?
That's not the whole piece, right? They're having they're having their medicine for disease management, but when we're talking about well-being, then they want.
Yeah, but that is a certain amount of evangelism. How do you get the customers? Like it's, I mean, because it requires saying that you need this. Do they need it? They will ask the question, do I need it?
Yeah. So I mean, it goes back. So 200 years before, you right down to the rural areas, Ayush is kind of very well set in terms of acceptance. The evangelism that one has to do is more on the urban areas and the more educated people who have got stuck to the conventional medical system. For them, we have blogs, we have a whole bunch of digital marketing efforts that we're doing.
Great, thank you. In conclusion, hopefully I gave you enough to say that the business model tuning, fine-tuning is very important before you put a lot of effort, resources, time, costs, etc. So think carefully how you're going to get to the first milestone. Is the first milestone reasonable to achieve? How am I going to achieve it? Take stock of it, try different things, try different hypotheses. Here this may work, that may work, and then make your decisions as you go. Okay? Best wishes to all.